Okay, folks, let's get started.
You know, you keep taking everything on faith. How do you know what's real and what's not?
We just do.
Show me awake brain surgery on him. McDreamy.
Well, I'm Krish Sridhar from Chennai, and I'm certainly not McDreamy or Derek Shepherd or the neurosurgeon everybody wants to be. All the women want neurosurgeons to be like him, all the men want to be like him, but we are just the cat looking into the mirror. The idea of what neurosurgeons are very often is portrayed in media. Not only Derek Shepherd, but we have Steve Martin, who acted as the man with two brains, and then you can see there that he is operating on two people, and he screws off their heads and operates on them. And then you have the gifted man, a brilliant neurosurgeon, self-absorbed, cold and distant, or Dr. Death, who killed his patients doing simple spine surgery. Now, the portrayal of neurosurgery in medical drama is a lot of sensationalism. Of course, it has to be, but there is also a lot of misinformation and sometimes unfavorable portrayal of neurosurgeons. And the general public's picture of neurosurgery is widely influenced by the media. Neurosurgery in cinema is often a barbarous act, and neurosurgeons should strive to communicate a correct and positive image of neurosurgery. Though we cannot censor movies, we need to keep an eye on all of this and perhaps have advocacy towards more positive portrayals. We all know the impact of broadcasting on society. It's the best way to disseminate knowledge. But you have negative impacts as well, and most often there is a lot of prejudice and negative light which is seen when it comes to broadcasting. Because if it bleeds, it leads. And that is what the media goes with. Any content that evokes high arousal, emotional response, whether positive or negative, will tend to be more viral. The question is, how do we see ourselves? We see ourselves as better than rocket scientists, extremely intelligent, doing extreme complicated work, and we say it's not rocket science, we mean it is far more complicated. And actually in the PMJ in 2021, there was an article which looked at whether brain surgery is harder than rocket science. And so this is how we are portraying ourselves. So are we okay with projecting ourselves or allowing ourselves to be projected as someone with overinflated egos? Even the media makes a joke of it.
Parking's an absolute nightmare around here, isn't it? Had to reverse into the tiniest of spaces. Still, I managed it. I mean, parking's not exactly brain surgery, is it? And I should know.
Why is that? Are you a doctor?
Careful, not a doctor. I'm a brain surgeon. Big difference. Big difference. Yeah, I actually know a joke about this. What's the difference between a doctor and a brain surgeon? One's not exactly brain surgery. The other is brain surgery. So, what do you guys do?
I'm an accountant.
Oh, that's good. Yeah, I could do with an accountant. Filling in those tax forms can get really confusing, can't it? Still, it's not exactly brain surgery, is it? I mean, brain surgery, believe me, is very complex. Are you an accountant too?
No.
Well, so we now know that TV and films influence how society looks at us, but we also have religion and social practices, social influences, and of course, Google. So in India, we have this Indian mythology of a guy who's an evil guy, and therefore, the belief, therefore, which came out of this mythology story is that anyone touching the head can cause death. Now, they came with this article which looked at the beliefs which came out of epilepsy, and on a scale of 1 to 10, people thought that brain surgery was rated as having a mean dangerousness of 8.3, and that 24% of patients would not allow their children to marry someone with epilepsy. Public awareness from sub-Saharan Africa, only a handful, only 30% believed that it was necessary to go to a neurosurgeon as soon as possible. And people believed that somebody from outside Africa would be better to treat them. And that was because of the unwillingness to recommend in-country neurosurgical services when it came from a rural background. And that was because of a lack of awareness about the availability of neurosurgeons, and most people thought that neurosurgery is expensive. From Oman, 80% of participants thought that neurosurgery operations are difficult and can fail. But this doesn't help. A well-known neurosurgeon, even better known in society as a writer, when he says that a career in neurosurgeon appealed to my competitive alpha male nature, blah blah, what could be more glorious than being a brain surgeon? And then he goes on to say, right there, that brain surgery is particularly dangerous, risking not only death, paralysis, or blindness, but also changes in our intellect, personality, our very being. After reading this in the Economic Times, who would get operated on the brain? And therefore we have this two-sided things. One is an image of neurosurgery and neurosurgeons, which is absolutely different from what reality is. And the second is when the patient comes here and says, no detectable brain activity, doc, is that good or bad? And that's the level of ignorance. And this is not a joke. So who are we talking to? Most of the time, like here, it's ourselves. Whether it is in conferences, webinars, we are talking to ourselves. Or we are giving information and talking to people who are already patients and who want to know about the disease. So they come to our websites and look at what we have there to give them. But we need to act fast, we need to start to change, and we need to communicate with society. We need to talk to society more often. We say, we feel from the heart, we love from the heart, we do this. But it's all here, isn't it? But nobody knows that. And that needs to change. And the way to change it now is with the big five. This is how society communicates now. And more away from Facebook and more into Insta. But of course, Dr. Google is always there for any information anybody wants, but we have to start controlling that. Social media has been shown to be effective. For example, in this particular case where there were graphics, it found that in 72 hours, over 100,000 views were seen by the society. Lawrence of Arabia, we know, we've all seen Pietro Tool in this movie. The actual Lawrence died due to a head injury while riding a bike, and it's only after that this neurosurgeon took it up in Britain and we started having the helmet rule. So we need to use the popularity of celebrities to improve awareness and make a change. And there's no dearth of celebrities who have had some sort of brain injury, surgery, something. One of the popular Indian actors, Hrithik Roshan, was operated upon by Basan, and luckily for us, his mother had some good things to say. But not always the case. Emilia Clarke, who had 2 aneurysmal bleeding.
She makes quite a serious reveal.
You've seen a scan of your brain, haven't you?
Yeah, and there's quite a bit missing.
Literally, really.
Yeah, which always makes me laugh. Yes, yeah. Because strokes, basically, as soon as any part of your brain doesn't get blood for a second, it's gone.
And she says it's as though I've been through a war more gruesome than any that my character experienced. So while she's doing a lot for charity and things like that, people hear what she has to say, that it was a very gruesome and troublesome period of her life. So we need to make these people who have come out doing well, acting again, doing things, influencers, to influence society. And this perhaps sums up the whole thing. Communication plays a crucial role in overcoming biases. We suggest developing communication packages on neurosurgical disease and the scope of practices in local languages that is easy to understand which should not have confusing medical terminology, non-essential information, or information that may promote mistrust of health information or personnel. Something very simple, just like this. We utilize the big five. Use of infographics, that's the new key term. We have to make it easily understandable. Use reels, less than 1 minute to say what you want. Catch them young. Get comics, illustrations for children to read so that you change their perception, their knowledge from when they are young. Use broadcasting. Educational broadcasting is especially important where there is less formal education. And use the society. In the Neurological Society of India, we have a regular, every year during our annual conference, a public awareness program. We either do it having celebrities, like here you can see in Mumbai in 2013, Amitabh Bachchan, again a famous actor, came and took a pledge.
All I'm trying to say is, it should be a routine for a bike rider that first you wear a helmet. The second step is the brilliant rider.
So when we have days like the World Neurosurgeons Day, let's not celebrate just ourselves, but we need to tell people who we really are and what we really do. We need to engage with the public, make the common person understand what we do, and neurosurgery needs to become a household name. If you tell me in India, everybody knows cardiac disease. If you say, I have chest pain, they know they have to have an angiogram done, they perhaps would need a stent, and they perhaps would need a bypass. But if you say, you got a stroke, you need something, do I? You mean to say blood vessels really go to the brain? That's the level and that's the knowledge which we need to show around. Ibn Alexander in 1967 said that continuous involvement is a fact of life. And that is true. And I think the WFNS has a major role in this. We need content and promotion of all this. We need to bring out standardized and basic material for the public. We need graphics which are often expensive to make for explaining surgeries and procedures. And the WFNS can do this as an organization. Because WFNS needs to take neurosurgery to society and to the world. Thank you very much.